What's up, guys? Hey, it's Paul Kolaski here with Vallejo Physical Therapy, and as many of you know, or some of you have been recently introduced to me, you know that my mission and the mission of Vallejo Physical Therapy has been to end chronic pain. So, when we're looking at pain, and specifically chronic pain, which is defined as pain that lasts longer than 3 months, we're typically kind of dealing with some things that the body hasn't gotten back into doing normally. Typically the healing process is pretty well taken care of itself, and there's some reason why the body's not moving right, or is still having pain in certain areas. You guys know we've been going after plantar fasciitis at Vallejo now big time over the course of the last year, 2 years prior to the hurricane. I hate that diagnosis. And so we've really been working hard to get after plantar fascia. And with that, there's been a lot of clients that have come up and been like, hey, I know this is a plantar fascia course or a seminar. Is there anything else that you guys work on? Specifically some of these other more complicated type pain conditions. So fibromyalgia, complex pain syndromes that can happen in the extremities. And absolutely there are. The techniques that we use, and a lot of the techniques that we brought into Vallejo were brought in specifically with these complicated pain conditions in mind, and for us to work on treating those. I think to fully understand my thoughts on this, you kind of have to know where I came from, all right, and where I'm trying to get to with treating chronic pain. And so when you think about, so for me, when I started, my passion for working with the human body began back in 1993 when I was still in the Air Force. And I used to do a lot of workout programs and weight loss programs for my office mates. And it just really intrigued me how we could work with the human body and get it to do things that we were kind of after and wanting to make it adapt. And so I found it fascinating. And so with that, this is 1993, so we're talking 25 years ago. Coming out of there, I jumped into Colorado State University looking at athletic training and sports medicine specifically. So dealing with the elite Division I athletes who were really kind of, they're motivated to get back in. These guys are on scholarship. They need to be healthy. They're playing football. They were our track athletes. And so we want to get these kids back as fast as we possibly can. So again, very highly motivated. And so, I really developed during that time problem-solving skills, question asking skills, critical thinking skills, and looking at really exploring a lot of the other options that might be available globally. So not just looking at what are we currently using in the U.S. To help with the rehab programs, but really expanding our horizons and saying, hey, what are some other places using? What are the pros using? What are other countries using that help get these athletes back onto the field quicker and hopefully with improved performance? With that, though, I never wanted to work with the public. I had professors at CSU that were like, Paul, you've got to go into physical therapy. I'm like, dude, no, I'm not going into physical therapy. And so it was kind of an evolution, all right, with that. I thought the athletes were more motivated. And what I came to find out as I was working through the process, I got down to Houston. My wife was, my wife had the opportunity to get her dream job at NASA. And so we came down to Houston, and at that point, I kind of started doing a lot of work in and around the Med Center area, and had the opportunity to work with a 70-year-old client who was she was a pianist, and she had lost the ability to use her right hand and her fingers in a way that allowed her to continue playing the piano. And again, understand, at this time, I'm still an athletic trainer. I haven't gone to physical therapy school. I'm still an ATC, and I got asked to work on this case because the people knew me, and they had worked on some other things for them, and they're like, hey, this kid, really gets after it. He doesn't know the meaning of give up, and just works to be creative with the treatment process. And so, lo and behold, 3 months later, and with again some very creative therapy and a very, very motivated individual, she really worked hard to get back into using the piano, or working, using her hands and fingers to be able to play the piano. And it was very interesting in that particular case. I remember talking to my wife about it specifically. It was that really helping someone get back to their life dreams, their life goals, restore hope. She had mentioned she was on the verge of losing hope that she was going to be able to go back to her piano playing, and it was something that drove me in my research, and really trying to find creative ways to get her back quicker. With those conversations came, it's like, all right, well, what are you going to do next? And so at that point, now 6 months later, I'm in physical therapy school. So I was like, all right, it was an amazing experience to be able to work with a motivated individual and get them back to something they really truly enjoyed and loved doing. So I wanted to bring that philosophy to the public. It's like, all right, let me figure out a way through PT to do that, and I figured it was opening my own facility. Boy, I don't know if I realized what I was getting into. Now 11 years ago, 12 years ago, what are we at, 11 years now? Wherever we're at now, 2007 is when we opened, 11 years ago. And so, we opened Vallejo Physical Therapy with the intent, with the mission of ending chronic pain and giving people hope back, okay? And, as of today, we've seen over 6,000, or helped over 6,000 patients with that, which I just would not have ever dreamed that would have been where we would end up at this point in time. And I think that it's something that drives us to keep us going, to bring these solutions to people here in the future and today. And so, it wasn't all rainbows and cupcakes. Our first year, I got really good at getting people 70% better. I tell this story to my staff all the time as to what drives my continuing education, and is that when you go through a year where every patient you see only gets 70% improved, you get frustrated, they get frustrated, and you have to decide, is this how it's going to be? And for me, it wasn't good enough. And so at that point, my problem solving, critical thinking skills all really kicked back into full mode, kind of went athlete training style in the physical therapy world, and decided, hey, I'm going to look for some faster acting techniques. And this is when we brought in the low level laser. We started incorporating a lot more massage therapy. We started doing a lot more trigger point therapy work. Brought in the dry needling at that point in time. Kinesiotaping. Oh my gosh, instrument assisted soft tissue mobilization, using the scraping tools. During that time, we ended up in the acupuncture world. We ended up with doing nutritional assessments with clients, all the way to whole body cryotherapy that we do also now to help with a lot of these complicated cases, and just really focusing in on the whole body approach is what we have really kind of decided that, hey, this is where it's going to be. And I think the biggest thing to think about with that is that you can't just treat the site of pain. I think that's where a novice typically is going to make an error. You're treating where the brain thinks the problem is, and the brain is just giving you information. It's just saying, hey, something's not right in the system, and this area here is yelling at me. And so you've got to dive in a little bit deeper and find what that root cause is. Again, that could be anything, okay, from nutritional deficit, poor sleeping habits, poor breathing habits. We've been on that like nobody's business here recently. Prolonged exposure to muscle imbalances. Prolonged exposure to muscle imbalances. This was, sort of historically called the repetitive stress injuries, okay, repetitive use. All right, so when you're using your body or forcing your body to work in an imbalanced environment over long periods of time, compensation happens, guys. Compensation will happen. Certain muscles are going to get overworked, over-shortened. Other muscles are going to get over-lengthened. You're just going to start to see the body's not going to move the way that it was originally intended or designed to do. So you start to see these imbalances, and eventually you have them long enough, then all of a sudden pain crops up. Or you could also have the nervous system just acting crazy, okay, which we've seen that. We see that a lot in the complex pain syndromes or pain cases where the nervous system, for whatever reason, it over responds to a stimulus, and there's no threat. But it is definitely a perceived threat, so the body freaks out and decides it wants to try to do something about it. So it kicks off a pain response and doesn't let you bear weight. So the really good thing here, though, is that once you find and dig down and get into that root cause, typically treatment works really, really fast. And this is where the root of our fast-acting techniques came from. We started seeing patients that were getting better in 6 sessions, 4 sessions. The one we love the most, the one and done. All right, that's our most favorite. Patient comes in, has some kind of structural issue happen or strain issue happen, and boom, we were able to get them either significantly improved or completely improved in 1 session. A couple cases that I can think of along those lines is one specifically, of course, a plantar fascia case that I'd love to harp on. I was going to talk about plantar fascia. I can't stand plantar fasciitis. All right, I had pain in both of my feet, stopped me from doing what I love to do, running, playing with my daughter. So I don't play around with plantar fasciitis. Get rid of it. But in this particular case, guys, this was a teacher that came to us. She had undergone 12 months of treatment for the heel pain issues, and came into us basically crying because she hadn't been able to get it fixed. And if we weren't going to be able to fix her, then she was going to have to change her profession. And she really, really enjoyed teaching. And so 45 minutes into our session, we had found a calf issue and a core issue that was giving her grief that we believe was part of the root cause of what she had going on. We worked on both of those. 45 minutes later, she was up walking barefoot in our facility at 80% improved 45 minutes. So things can, just because there's pain in a certain area, man, you can dive in and find something that will flip a switch with the body and allow it to improve very, very rapidly. Of course, at that point, the crying came on even worse. This time, obviously, it was a different type of crying. She was super excited, and we saw that patient for 6 sessions, and she was discharged back to full life and back to teaching. The second case that I'm thinking of is a teenager that we saw from Michigan. Yeah, I said Michigan, way on the north side of the country. Her parents flew her down to work with us for 2 weeks for some of the stuff that we had been doing with complex pain cases. And this particular girl, she was having foot and ankle issues, was not able to bear weight, wasn't able to put her cowboy boots on, which or her riding boots, which was a big deal for this particular patient because she was a competitive rider and wanted to continue to do that. In this particular case, it was nervous system overload. The nervous system was not responding appropriately to what was going on, and ultimately what we ended up doing with this, in this case, was using the whole body cryotherapy sauna to shock the nervous system, and then we progressively controlled her weight bearing using the Ultra G treadmill, the unloading treadmill we have in the facility, and she was 60% improved within the first week. And then boots were back on at day 9, and she was completely pain-free, walking barefoot with the boots as she wanted to at 2 weeks. And to this day, she's back to riding with no issues. I do follow those guys on Facebook, and she's doing phenomenal. So when you think about finding the root cause, then it's up to us as a team, Vallejo and the patient, you, to really do whatever it takes at that point in time to get it done. Okay, to dive in. Most of the times this chronic pain that we get ourselves in didn't happen, guys. It didn't happen overnight. This is something that was a daily condition that came on over time, and it's going to take a daily treatment over time to resolve. Okay, that is the biggest misconception that I see with clients is that, if you've had a prolonged muscle imbalance that you've been doing with your body, you didn't get in a bad position. Even if you slipped and fell, even if you had a car accident, okay, those imbalances were already there. You just needed a little bit of something to shove you over the edge, okay? And that's where I think that people got to understand that this is it's a daily prescription, all right? That you got to get in there, do something, change things daily in order to make a lasting impact and completely get rid of everything that you're feeling. But it can happen, and in most cases, it can be resolved. All right. So how can you find out if we can help your case? That's a great question. Easiest way to do that, guys, is to click the link below or on this page. If this was an email, click this link and save your seat for the upcoming seminar that we have talking about chronic pain. We're going to dive a little bit deeper into some of these causes and how some of these treatments can be more effective and getting you back to life. Okay, that's our number one goal. In that pain, get back to life, restore hope, guys. We can't wait to see you, and we'll be pumped up to see you soon. Okay, so again, Paul Koloski, Vallejo Physical Therapy, and let's get it done. Have a great one.